In a small animal, finger covered with a sterile coat or by using a sterile fecal spoon or by enema. The first point should be collected 10 gram at least of freshly voided feces. The next phases for the parasitology should fill the container. And next, if the transport time are likely longer than 24 hours, the sample should be sent on the ice or refrigerated to prevent the hatching of the parasite egg. This is so important point. Feces are the best stored and transport at 4 degrees centigrade. The sterile swab can be taken from the rectum for the bacterial examination. The fourth type of the sample is urine sample. There is different method uses for the collection urine. The urine, of course, in the urinary bladder is normally sterile, and the urethra has microflora. So, urine collected from the animal via several methods, as I said before. First, manual compression of the urinary bladder. A continuous pressure should be done for the several minutes until the sphincter of the urethra relaxes and the urine is expelled. The bladder in small animal is obtained by the abdominal palpation, while a gentle, continuous pressure in the large animal can be applied through rectal palpation. The next methods is catheterization. Catheterization used in female large animal. Care must be taken to avoid contamination and traumatic injury because this is maybe need occurrence during the collection. So the sterile catheter should be used and utilization sterile forceps and wearing the sterilized rubber gloves and the first portion of aspired urine should be discarded and the sample collected by the catheterization often contain a few RBCs. The third method is cystostenosis. Okay, so the cystostenosis or stenosis indicate for the bacterial culture and used in the small animal only when the bladder contain a sufficient volume of urine so that it is readily palpable. Sorry, the skin should be cleaned and prepared aesthetically. The next, the bladder should be held firmly, and the last, use of a syringe and needle. The fifth type of sample is abortion cases. If possible, well, fetus should be submit, else fetal abomasum content lung or liver, and even a sample of any cross lesion in or in the fetus should be sent. The next, a piece of affected placenta and two or more cotyledon from the aborted animal. Uterine discharge and especially if no placenta is available. If there is leptospiral abortion, 20 ml of mid-sperm urine from the dam preserved with 1.5 ml for 10% formalin. The sixth type of sample is nasal discharge and saliva and tears. In the first sample must be taken with a cotton or gauze swab. Uh, it may be help if the swab is first moistened with the transport media. This is the base for the maybe proliferation. The third point, the swab should be allowed to remain in contact with the secretion for up 1 minute and then place in the transport media such as nutrient broth and sent